Up. We are so lucky to have Sammee Albano with us. She is um, an RN and an international board certified lactation specialist, and that says a lot. That so she knows her business. She is working. I mean, she's been working with moms for a super long time. So she is going to talk to us about successful breastfeeding. So go ahead and take it away, Sammee.
Is it working?
There we go.
Okay, so this is my granddaughter. She's 9 now. and Our breasts are made to make milk. So often when I work with moms, they'll tell me, I'm going to try to breastfeed. There's just been, they've heard so many stories of I didn't have enough milk and my nipples cracked and bled and on and on and on. So women are really insecure about having the ability to nourish their children. So I tell them breasts are made to make milk. That's what they're made to do. They prepare for milk production during pregnancy. So along the front of our chests, we have oxytocin receptors. So when we hug someone, we activate those oxytocin receptors, and that makes us feel good. When we have our baby on our chest, we activate those oxytocin receptors, gives us a feeling of well-being. So it's really important that skin to skin that all the hospitals are doing now, and of course Sharon and Colleen do it all the time for their home births, that skin to skin contact right after birth is so important in getting the milk production off to a good start. So oxytocin brings milk to the surface. Prolactin is the hormone that produces milk, but oxytocin is a hormone that brings milk to the surface. And within the breast, there's these little epithelial cells called myoepithelial cells, and they contract. They're like tiny little muscles that contract under the influence of oxytocin, and it brings the milk to the surface so the baby can get it. Um, we always talk about the benefits of breastfeeding for the baby, but there's also a lot of benefits for the mom. Breastfeeding causes the uterus to contract. So, right after birth, when her uterus is tired from pushing out the baby and pushing out the placenta, when the baby is at the breast suckling, it causes that oxytocin to be released again and causes the uterus to contract again. So, it helps the fibers in the uterus come closer together to prevent excessive bleeding or postpartum hemorrhage. So that also prevents hemoglobin hematocrit from dropping, helping to prevent postpartum anemia. That oxytocin helps the mom really bond with the baby. There's multiple studies that have been done where they've shown that a mom who has breastfed her child is much less likely to abuse, abandon, or neglect her child. So when I had a program with here on Kauai with first time moms, Hi'ile Kauai perinatal program, I had it for 12 years. And I received a lot of money from child abuse prevention. So, by encouraging moms to breastfeed and helping them to breastfeed successfully and reach their breastfeeding goals, we're actually impacting them for generations because neglect and abandonment and abuse is so cyclical. So, if we can stop it at one generation, we can stop it at multiple generations in the future. So it delays ovulation and menstruation, helping us to aid our babies by breastfeeding. It also reduces a mother's risk of getting breast cancer, endometrial, ovarian cancers. And in America, 1 in 8 women get breast cancer now, which is huge statistically. So again, our breasts are made to make milk, and when they don't make milk, when we're pregnant, and then we don't continue that cycle and by breastfeeding after our pregnancies, it just changes our hormonal structure, our ratios, and everything, and it makes us more likely to contract breast cancer. It's dose dependent breastfeeding, so the more The longer she breastfeeds, for every year mom breastfeeds, she reduces her risk of breast cancer by 19%. So 5 years is the magic number to breastfeed. And I'm sure Colleen's got that in the bag. I think she did 2.5 with each kid. It saves time. The milk is always ready at just the right temperature, just the right amount. There's nothing to wash, nothing to prepare. It also, another benefit for the mom is it lowers her risk of developing high blood pressure. They did this study with 300,000 Chinese women, and it lowered their risk of heart attack, high blood pressure, any kind of cardiovascular disease for life. So it's not only good for the baby, but it's good for the mom for the rest of her life. It also reduces her risk of developing diabetes. Diabetes now is a huge drain on our medical system. So by breastfeeding her children, she's reducing her risk of getting diabetes, but she's also reducing her children's risk of getting diabetes. It also reduces her risk of developing high cholesterol. It strengthens the mother's bones. Now, I have no idea how this works, but she gives all this calcium to the baby when she's breastfeeding, and then she ends up with stronger bones. So she's less likely to get osteopenia, osteoporosis, hip fractures. If she falls and breaks her fall with her arm, she's less likely to break her arm. So women who choose not to breastfeed have a 4 times increase in hip fractures. Breastfeeding helps mom return to their pre-pregnant weight. They use up 500 calories a day making that milk. It decreases postpartum depression. That doesn't mean it eliminates it. As Colleen was saying, she actually had it and didn't realize it until she was out of the fog. I breastfed my first. I definitely had postpartum depression with my first. But those hormones help, that oxytocin. It also increases serotonin levels, which give you a feeling of well-being. So it does help the mom be less stressed, less anxious, more relaxed. Breast milk has a perfect balance of nutrients. So it's different for a boy and a girl. I don't know why the formula company hasn't picked up on this yet and made boy milk and girl milk, but I'm sure someday we'll see little brown cans and little little blue cans and little pink cans of formula. But a boy has a higher metabolism. Generally speaking, they have higher heart rates, and they just burn calories faster. So the breast milk for a boy has more proteins, more fats, and has a higher caloric content than for a girl. And a lot of people don't realize that. And when I tell them that, I think that's kind of a key thing in switching them from, oh, breast milk is really a lot better because it's gender specific, species specific. I work with a lot of people where no one in their family has ever breastfed. They don't have any cousins or friends or aunts or uncles, aunts or grandmas or their mother-in-law. Like no one in their family has ever done this. And how do you even go about it? They're really clueless. So anytime we can tell them about the superiority of breast milk and get their attention, it's a good thing to mention. Breast milk components change as the infant grows. So when the baby starts crawling and needs more calcium for bone development, the breast milk has more calcium in it. It has the right amount of fat, sugar, protein, water that's needed for a baby's growth and brain development, as well as protection against virus, bacteria, and fungus. So there's been a really cool research project that has gotten a lot of press lately where it talks about how when the baby compresses the breast when he's suckling and the milk goes into the baby's mouth, when the nipple pores fill back up with milk, it actually sucks some of the saliva from the baby into the breast. And the breast figures out what's going on in the baby's body and then gives that the antibacterial, antifungal, antiviral components, anti-cancer components even in breast milk, and then gives it to the baby. And it takes an average of 20 minutes for this to happen. So it's so specific to whatever's going on in the baby's body. They're thinking in the future they wouldn't have to do a bunch of tests on the baby as far as like swabs and blood tests and all that kind of stuff. They can just test the mom's milk and see what kind of antibodies she's making for what's going on with the baby, and then they'll be able to figure out why the baby is ill. The nutrients in breast milk are bioavailable. They're easily absorbed. If you look at breast milk under a microscope, it moves. It's like blood. It's alive. If you look at formula under a microscope, it doesn't go anywhere because it's been on the shelf for who knows how many months or years. Breast milk contains mucins, which are microscopic structures that envelop viruses and bacteria, preventing them from being absorbed into an infant's mucosa, the intestinal lining. So they're kind of like little Pac-Men, these mucins. So they engulf the bacteria and viruses, like say, the baby licked the shopping cart or something. So the mucins would be activated and would engulf those germs that the baby swallowed, and prevent them from being absorbed into the intestinal mucosa. So it's kind of, I think, to me, it's like magic. It just engulfs these things and takes it right out of the baby's body so the baby doesn't absorb it. Breast milk has antibodies, living cells, enzymes, hormones that make breast milk perfect for the infant. These components cannot be duplicated. Every year we hear about something else that they've added to formula to try and make it as good as breast milk, and it's new and improved, and breast milk just can't be improved upon. It's got everything our babies need. And if you give birth like a week earlier, you'll make milk appropriate for your baby that's not term. Or if you give birth 3 weeks or 2 months earlier, you'll make appropriate milk for that baby's gestational age. If you give birth at 41 or 42 weeks, you'll make different milk than you would if you gave birth at 40 weeks. So our breasts are constantly making sure that we're making exactly what our baby needs. Okay, we talked about the shopping cart. So the babysitter, when wherever a mom goes, she makes antibodies for that environment. So when she's home, she's making antibodies for everything that the baby's exposed to in the home. But so many moms now take babies to babysitters because so many moms are working. So when she goes and takes the baby to the babysitter, it's important that she hug the babysitter so that she transfers some of the germs from the babysitter to herself, because we all have our own like microbiome. So by hugging the babysitter, and even if she sits down on the carpet and plays with some of the toys while she's dropping off her baby, she'll expose herself to whatever's going on in that environment, and then she'll make antibodies for it. So then when she's at work and she's pumping her breast milk will contain antibodies for the babysitter's environment that the baby will get later on. The mother with bronchitis who's got the green snotty nose, I get this phone call a lot. It's totally fine for her to breastfeed. Whatever she's been exposed to, the baby's been exposed to too. But a lot of people think, oh, I'm sick, I can't breastfeed because then my breast milk has, germs in it. But it's totally fine to breastfeed. 72757. So when a baby is born, their stomach is very small, and they can only handle about 7 cc's, which is about a teaspoon and a half of colostrum. And that's exactly what the mom has. So within 3 days, though, the size of the stomach grows so that then they can handle about 27 cc's of breast milk. And that's usually when the transitional milk is kind of coming in. And so that's about an ounce. And that's when the baby's, poop, the black poop is coming out. And colostrum has a laxative effect. So that's really good for them to drink a lot of the colostrum in the beginning, lots of skin to skin time, so that meconium, the black poop, gets out of the baby. Because when they're full of poop, they think they're full and they're good and they kind of don't need to eat too much. So it's important to get that black poop out of there. And then within a week, they can already handle 57 cc's, which is about 2 ounces. So their stomach capacity grows quite quickly. And that was one of my test questions on the IBCLC exam. And that's my husband's birthday, 7/27/57. So that's kind of funny. Mexico burn patients, they put breast milk on there, and it's antibacterial and really high in fat. So it really helps burn patients heal quickly, burn victims heal quickly. Everybody knows that if somebody's got pink eye, you find out who's breastfeeding on your street and go get some breast milk and stick it in there, and it helps the pink eye heal. In breast milk, in Europe, you can actually purchase breast milk, and you can purchase breast milk ice cream. In America, we can't buy breast milk or sell it because it's considered a body part, but men can sell their sperm to sperm banks. So I don't know why that's different. But anyway, you can tell a baby is full when their hands are relaxed. When they're hungry, their hands are like in fists and their elbows are bent and their hands are close to their face. When they're full, their hands are open, their elbows are straightened, and their hands are away from their face. So there's a lot of babies telling us by their body language. There's a really cool episode on YouTube called Baby Language, and it's an Oprah episode. And the woman who does it, her name is blank. I can't think of it. Anyway, she's from Australia, and she has an auditory memory. So she realized when her son was born that when he said certain sounds, he meant he was hungry. And when he said other sounds, he needed to burp. So she studied thousands of babies and came up with this baby language. And it's just fascinating if you want to watch it on YouTube. The Enterobacter Sakazaki bacteria is a bacteria that's in formula. So it's important to handle formula correctly because babies still die from ingesting formula in the United States. And it's not because their water wasn't clean, it's because of the germs in the formula. So if moms are going to use formula for supplementing or something like that, it's important that they don't put the scoop back in the can, the formula can, because there's germs on our hands and there's sugars in the formula, and it just causes the Enterobacter Sakazaki bacteria to proliferate in the formula can. And then you'll see, like a lot of moms will say, oh, this baby can't handle this formula, can't handle this formula. When it's actually at the bottom of the can of the formula, when the bacteria is most concentrated, that the baby gets diarrhea and gets really ill. So don't ever put the scoop back in the formula can. And if you look on the CDC website, the Center for Disease Control in Washington, you'll see where it talks about correct ways of preparing formula. And what you need to do is boil the water, not to kill the germs in the water, but to kill the germs in the formula. So you put the formula, you put the hot water in the bottle and up to the mark, whether it's 1 ounce or 2 ounce, and then you put the appropriate number of scoops in there when the water is still hot. So then you mix it up so that it kills the Sakazaki bacteria. The early cues for breastfeeding, so often people think, oh, he's crying, I have to breastfeed him. But he's been telling you for a long time before he's crying that he's hungry. And that's little things like just licking his lips, turning his head from side to side, rooting. So those are all early signs of hunger. And it's so much easier to get a calm baby on the breast than it is to get a baby who's frantic and crying and crying and crying. So it's nice to feed them at their first early cues. If they are crying and you're trying to get them to the breast, if you just put your finger in his mouth for a minute and just let him kind of calm down and suckle on his finger. Now, okay, the world's a good place. Have him close to the breast so he can smell the breast, and then take the finger out and latch him onto the breast. Montgomery tubercles are those bumpy little things on your nipples, and they secrete an oily substance that smells like amniotic fluid. So when the baby is born, the baby naturally goes towards the nipple, which has become darker throughout pregnancy, so it's easier for the baby to see. And the baby will go just like puppies and kittens, they can't, their eyes aren't even open, and yet they know by smell where the teat is, and they go and latch on. So that oily substance smelling like amniotic fluid coming out of the Montgomery tubercles, the baby smells that and is able to crawl by himself or herself over to the breast and self-attach. The formula scoop we talked about, the cleansed fish we talked about. Formula is the fifth most profitable business in the world. Sad to say. Okay, the composition of breast milk changes within a feeding throughout the day and as the baby grows each day. So when the baby wakes up in the morning, the breast milk is very watery, and there's a large volume of milk because the prolactin level is highest at about 3 o'clock in the morning. Remember, prolactin is the hormone that makes milk. So moms wake up with pretty full breasts in the morning, but the milk then is very watery. So the baby nurses on one side, burp, change the diaper, nurses on the other side, and the baby gets full pretty easy because there's a large volume of milk. But later on in the evening, usually like 4, 5, 6, 7 o'clock when you're trying to make dinner and your husband comes home, and your baby will cluster feed. So the volume has decreased throughout the day of your breast milk because the water content has gotten less and less and less throughout the day. So you still have enough milk. This is when a lot of women throw in the towels. You still have enough volume of milk, but it's more concentrated. So there's a higher concentration of calories and fats and proteins, but the volume is less. So the baby needs to cluster feed. So the baby will go from the left to the right, then right to the left, left to the right. And, sometimes you'll just sit there for like an hour and a half and go, my gosh, I have nothing left. I dried up, baby's still hungry. And that's when mom's throwing the towel. But what they're trying to do is get the same volume they got in the morning very quickly with a large volume of waterier milk. They're trying to get full, but this milk is a higher concentration of nutrients and calories so that it takes longer for them to digest it, and they'll sleep longer. So it's important just to watch the baby, not the clock. So if you've been feeding for an hour and a half and it's, in the evening or late afternoon, that's just what babies do. So all around the world, babies nurse for an average of 140 minutes a day. In the US, that's about 10 feedings a day for about 14 minutes. In the Kalahari deserts, babies nurse 60 times a day for about 2.5 minutes per feeding. So this study that they did in the Kalahari desert, they asked these moms, how often does your baby breastfeed? And they had no idea. So they followed them because in the desert, the moms wear the babies all the time. And so the baby just has full access to the breast. So the baby just nurses whenever he's hungry, and the mom pays no attention because they're doing it 60 times a day. But I guess it's pretty important that 60 times a day prevents them from getting dehydrated living in the desert. But it's about the same of the 140 minutes that the US baby feeds. And I found that pretty interesting, that however they work it, babies will get what they need. A mother nursing a boy, we talked about that. Spacing babies. This doesn't always work. I breastfed all my kids, and spacing the babies. As soon as I was 6 weeks postpartum, I had a period already. And I was so bummed because I was hoping that I could space my menses a little bit. My daughter did it correctly, though. I think she was about 2 years postpartum before she had her first. Breastfeeding saves money, so families can purchase other necessities. Less water and electricity is needed since water doesn't need to be boiled for formula preparation, and bottles don't need to be washed. Especially now with the pandemic, it's so important for these moms to be breastfeeding. It's kind of scary to be giving birth right now because if a mom just has a cold or a cough, her baby is separated from her. And it makes no sense at all because the Center for Disease Control in Washington says don't separate them, even if she's positive for COVID-19. And so the World Health Organization says don't separate them. And hospitals are still separating them. And then in 36, 48 hours, she takes the baby home. So the baby's gotten, maybe some formula, maybe some expressed colostrum if someone showed the mom how to do it, but they've been separated. To me, that's a human rights violation. I'm so upset with what's going on right now in labor and delivery suites. Anyway, okay. It reduces gas and car expense. Families don't have to go to the store to purchase formula bottles and nipples. Breastfed babies are healthier. Parents won't need to leave work or off as often to pick up a sick child, take the child to the doctor, go to the pharmacy, pick up a prescription, on and on. I'm working in breastfeeding workforce right now, statewide, trying to get the biggest health insurance company in the state, HMSA, to provide lactation services. I'm in network right now with Aloha Care and UHA and Kaiser, and I can go to moms' homes and do lactation consults and do telehealth consults and teach breastfeeding classes and childbirth classes, and it's all covered if you have Aloha Care, Kaiser, or UHA, but HMSA still won't cover those things if a lactation consultant bills for them. So we actually put together a slide presentation and figured out that HMSA would save $5,000 a year for every child that was breastfed at least 6 months if they paid for 4 lactation visits. And the mom was able to breastfeed exclusively for 6 months. They would save $5,000 a year per child. And for the mom, they would save $8,000 a year by preventing her from having diabetes and high blood pressure and cardiac disease and all of that kind of stuff. So it's a huge cost-effective implementation that we're still working on implementing. Okay. Benefits to society. Mom is at work, not home, taking care of a sick child. Higher productivity for businesses. That's why more and more businesses are designating a lactation room so the mom can go and pump her milk while she's working and store it in a little refrigerator there and take it home, because they're realizing if they allow the mom to pump and store her milk while she's at work more often, which is what they want. They don't want people calling in sick, right? Decreases amount of waste in the landfill. If all babies in the US were breastfed exclusively for 6 months, it would save $13 billion a year, every year, in medical costs. And that's huge. But going back to the 5th largest profit-making business in the world is formula production. So that's why there's not a whole lot of push to breastfeed in the US. Formula is missing tons of ingredients that breast milk has. Anti-parasitical components, anti-allergy components, hormones. And even though it says minerals, vitamins, fat, and DHA, it's not the same. We were talking earlier about how it's bioavailable, so it's perfectly absorbable, whereas formula, the protein is a foreign protein. It's a cow protein, so it's not absorbed the same way. And actually, it's interesting that we even use cow milk, because cow milk has like double the protein that breast milk has in it, and way less fat than breast milk. You see breast milk babies, breastfed babies, they're really, really chunky. And because formula just doesn't have as much fat in it as breast milk does. But actually the other mammal that human breast milk is the most similar to is camels. But I don't know, camels must be difficult to extract breast milk from. I don't know. Okay. Risk: artificial milk increases gastrointestinal disease. Necrotizing enterocolitis is a disease that preemies get. Their intestines actually turns black and necrotic and dies, and they have to have surgery and remove it. So if the baby gets pumped breast milk when they're preemies, it prevents that. And those are multi-million-dollar babies. Those preemies that end up with neck, they can cost like $7 million to keep alive. for months on end. Ulcerative colitis, gastroesophageal reflux disease, GERD, GERD, is really common nowadays. Even vomiting diarrhea is really common with formula. Crohn's disease is a disease that follows you throughout your life. It damaged intestinal wall. Asthma, allergies, leukemia. There's a real high incidence of leukemia in, I'm just hearing of more and more kids having leukemia, whereas before I didn't know anyone who had leukemia. Different kinds of cancers, respiratory infections, pneumonia, bronchitis, sudden infant death syndrome. People are always talking about, put your baby to sleep on the back. But in actuality, for every 87 formula-fed deaths from SIDS, there are only 3 breastfed deaths from SIDS. The other, because that only comes up to 90, but the other are mixed feedings. So people are still concerned about preventing SIDS, but a lot of those people aren't aware that breastfeeding helps prevent SIDS. Decreased IQ and lower test scores on children's developmental tests. They get sick more often, more likely to be hospitalized before their first birthday. It takes 6 weeks for the infant's gut pH to return to normal after 1 bottle of formula. When I worked in the hospital, I really didn't think 1 bottle of formula was that big of a deal. Now, of course, I know much different. When children are first born, their guts are open, so they have leaky guts. So there's spaces in the intestinal wall. So the breast milk goes in there, coats the intestinal wall, goes through the spaces, and is perfectly absorbed. But when you put formula in there, it's a foreign protein. The body doesn't really know what to do with it. And it goes through those spaces in the intestinal wall, and it's not perfectly absorbed. So it causes an inflammatory response just with 1 bottle of formula, and totally changes the microbiome and the pH of the intestine. Decreases bone density, improperly aligned teeth. So braces are like $6,500 now. All 3 of my kids had braces, but it increases the risk if you're going to feed a baby with a bottle. It increases the risk of them needing braces later on. Now, poor vision, I thought that was weird. Why does breastfeeding? Well, there's breast milk in there that nourishes the eyes, but also most people formula feed or bottle feed with the right hand. So the baby is always got like the right eye up against the person's body who's feeding it. And so they don't see as much as they do with the left eye. So that right eye doesn't get to be as developed as the left eye. So it's important, if you're going to bottle feed a baby, you got to switch from side to side. So hold the bottle with the right hand. Next time, hold the bottle with the left hand and have the baby in the crook of the right arm. Ear infections are huge with bottle-fed babies. Also dermatitis, eczema, psoriasis, increase in dental cavities. They think that when a mom breastfeeds a baby to sleep and the baby has breast milk in his mouth, that increases dental cavities, but it doesn't. Formula increases them much more than that. Hodgkin's disease, multiple sclerosis, diabetes. It's like pretty much every disease state known to man is increased when we are not breastfed, because that's the norm and that's what we need. So to have breastfeeding success, if you minimize the use of analgesics and epidural during labor, these do depress the infant. For years, I sat in childbirth classes and heard anesthesiologists say, oh no, this medication never gets to the baby. But now we know differently, and it does get to the baby. May result in poor suckling, slower weight gain, increased use of supplementation. Epiduralized babies have an artificially higher weight at birth due to the bolus the mother receives during labor. So in order to get an epidural, the mom gets like 1 or 2 bags of IV fluids, and that excess fluid gets to the baby. So when the baby's born, their birth weight is a little inflated. So when they pee out all that excess fluid, everybody freaks out and says, oh no, this baby lost 13% of the birth weight. Oh, 21% of the birth weight. That's a lot, but I actually saw that. Or, 10, 15% of the birth weight. And it takes a little bit longer for the babies to come back up. So I was actually working with a great international board certified lactation consultant, Dr. Railson, and he told me, when you have an epiduralized baby, don't take the birth weight to figure out if the weight loss is excessive or not. Take a 24-hour wait. Let the baby pee out all that excess fluid, and then take a 24-hour wait and see what the weight loss is from there. You can assist in establishing a calm atmosphere. That's where doulas come in handy for labor and delivery. Decrease adrenaline and cortisol. It has an inverse relationship to oxytocin. If you dim the lights in the labor suite, it increases the release of melatonin, the darkness hormone, which works synergistically with oxytocin to produce coordinated and more forceful contractions. So that's interesting. I don't know if you've ever had an animal, a cat or something in your house that went and hid in the closet to give birth. So animals instinctively know this, that it's nice to have that nice little protective cave, increasing their melatonin levels to shorten their labors. Increase the success of breastfeeding, allow healthy infants to remain in direct skin-to-skin contact with their mothers immediately after delivery until the first feeding is completed. That's between an hour and a half to 2 hours. The alert, healthy newborn infant is capable of latching onto a breast without specific assistance. That's what breast milk looks like magnified, and that's what formula looks like. Lots of big fat globules. American Academy of Pediatrics recommends skin to skin until the completion of the first feeding. So pretty much all the hospitals in Hawaii are doing this now. There are still hospitals in Louisiana where you take the baby away and you don't see your baby for 6 hours, because they're stabilizing them in the nursery. But when the baby's skin to skin with the mom, the heart rate stabilizes, the blood sugar, blood pressure, respiratory rate, and the infant's temperature is more stable. Mom's breasts do this thing called thermal synchrony. It allows the mother's body to warm up a cold infant. So if the baby's cold and you put the baby on the mom's breast, the breasts will heat up and warm up the baby. If the baby's too warm, the breast will cool off and cool off the baby. It increases the APGAR scores, blood sugar, temperature. Baby is calmer, less stressed when it's skin to skin with mom, and it increases the milk transfer. So babies return to the birth weight faster, reducing the incidence of jaundice. If somebody's pregnant, learn all you can about breastfeeding. Encourage women who are breastfeeding to continue. Around the world, kids breastfeed until they're about 4 years old. In America, they average wean about 3 months, which is really sad. Okay, your breast milk is better than formula. Educate. Breastfeeding is pono. Good, upright, correct, proper, excellent. Well-being, prosperity, benefit, duty. It's moral, it's righteous, it's virtuous, it's beneficial, successful, in perfect order, accurate, and necessary. And there's my granddaughter again. Okay, that's it. Where are you? Where is everybody? Okay. Okay, any questions? Okay, wait, I can't hear you, Michelle. I see you talking.
Okay. There. I was just saying how that was incredible. Absolutely incredible. So much information. I can't wait to go and listen to the recording again, so I get all that information again, because it's so much. But I see that there are some questions.
Sure.
So there's one from Alexandra. Do you see her? When should you stop breastfeeding?
Well, everybody's, got their own life to live. So, like I said, around the world, kids breastfeed until they're about 4 years old. I think that's probably a lot closer to, being normal as far as humans go. But some people, they're working full time, they can't pump, they're they've got, other kids, or, everybody just has their own life to live. So it's kind of depends.
Okay. There's a question from Liz. Do stress hormones in the mom get transferred to baby via breast milk? And things have been hectic lately, and I've noticed a little bit more chaotic nature in my baby. Does this have anything to do with it, do you think?
Yes, our hormones are transferred. And if you ask most moms who had a colicky baby, it's usually that first baby. Because, in all honesty, we really don't know what we're doing when we have that first kid. And we're just kind of winging it. And we're pretty nervous that we don't know what we're doing. And the kid feels all of that. And yes, stress hormones are transferred in the milk for sure.
Awesome. Oh my goodness. Any other questions, anybody? That was just mind-blowing. Oh wow, Sammee, that was incredible. Hey, Sammee, if you can stop your presentation,
Sure.
and then I'm going to put up your contact information. So give me
Okay.
a second here to get that. So if
So
anybody needs to,
if anyone does have HMSA, though, I am an HMSA pregnancy support nurse. So if you go on HMSA's website, you can just, if you're pregnant or postpartum within 2 months, you can just sign up, and I can work with you all throughout your pregnancy and then 2 months postpartum. And then if you have those other insurance, then the lactation consults are covered with Aloha Care, UHA, or Kaiser.